The innovation economy and the role of healthcare institutions in supporting soft power of nations. And that's going to be led by Hugo Hensley, Valuation Director at Brand Finance. So I'll be handing over to Hugo, who will then introduce his panel.
Hi, I'm Hugo Hensley. I'm one of the Valuation Directors at Brand Finance, and I head up our work in the healthcare industry. This is a slightly different presentation to some of the others we've had today. We were focused on one sort of industry and how that can integrate and operate in the field of nation branding, place branding, and soft power. So I've got a few short intro slides just to talk about what is our relevance here, what does Brand Finance measure in this capacity, and how sort of we can talk about and potentially use some of these great institutions that exist in, hospitals exist in every city, universities exist, top research universities exist in every country, and so how can they be used to build collaborations, relationships between nations. So this is the study, the main study that I use, so it's something developed by Brand Finance just over 3 years ago. And what we do is we look at the world's top hospitals. There didn't exist previously a study that was able to benchmark hospitals against each other on a global level. That was due to some reporting standards, different regulations around what can be done. And so we, as Brand Finance, focused on brand, focused on reputation, put together a study with the idea of being able to compare hospitals in Costa Rica, to Indonesia, to the UK, to America. And that's based on a research study looking into the top academic medical centres. When I say hospitals in relation to this study, actually everything in there is an academic medical centre. The reason for that is because international relationships and relations driven by hospitals and reputation for hospitals extending beyond borders is usually to do with tertiary care, academic medical centres, and university-linked and research hospitals. The reason is it's the research and academics that lead to the collaborations across borders. The research study is conducted in 30 countries, looking to be representative of sort of the healthcare market around the world, looking at 2,500 healthcare professionals and asking them questions on over 30 metrics, but mostly trying to derive what are the positive benefits a hospital can gain from having a strong reputation. The key ones that we look at are they able to attract employees? Are they able to drive hospital referrals and recommendations? But also, are they able to build collaborations and positive relationships in their research and academic fields? So looking at that, we can say, why do healthcare professionals recommend different institutions? Looking across recommending for teaching, so would you recommend someone study there? Would you recommend someone work there in an academic capacity? Would you recommend their research? So would you collaborate with them? Would you go there and conduct research at that institution or jointly with them? And patient care, would you refer someone to get patient care there, or would you actually recommend someone to go and work there in the clinical departments? What we're looking at here is the top metrics within our study at driving that referral and recommendation. So right over on the left, one of the most important for both, for each of teaching, research and patient care is actually an organisation that medical professionals are proud to have trained at. What that says is that personal level, that personal recommendation, that personal contact, that understanding from networks of medical professionals is the most important thing. So building that reputation, and then variably we see different metrics have different importance for the different categories. So in research, contributing new papers is of course much more important, whereas we see in teaching having a legal medical training program, so being seen as developing top doctors is most important for engaging with the academics of that institution. So built from that set of attributes and factors on which healthcare institutions are recommended, we build up our ranking of the top hospitals. This isn't the ranking, this is actually where do they come from. So trying to link this across to our soft power, we're saying who holds the most stock in these top hospitals. The US, huge country with massive healthcare spend and focus on healthcare, but also some of the highest quality research and clinical and academic institutions in the world, weighs very highly. But you also see the UK, Singapore, Germany, Switzerland, some of these nations that you might think of, but also some perhaps that you weren't so aware of. So Canada has very strong healthcare, India, very strong, lots of research connections. And that lines up very closely with what we see in our soft power ranking for who is rated as the most for advanced in technology and innovation. So at the top we have Japan, the US, Germany, South Korea, UK, all scoring very highly in the number of healthcare institutions in our ranking. One of the outliers here is China. You might notice, second for advanced in technology, but actually it doesn't currently have those healthcare relationships that are recognized by the healthcare professionals around the world who make up our survey. And so that's one of I think the first sort of key insights that we see here is that more can be done to communicate on the healthcare side of technology and innovation in a country that is otherwise very strongly regarded in that sense. And so the last part is looking at what drives soft power. So these are probably what you've been hearing about all day, the key behaviors that you're trying to drive through having a strong nation or place brand. So you want to be a place that people are looking to study in, invest in, work in, buy products and services from or visit. And you can see that education and science as one of the pillars of soft power ranks very highly among the areas driving that choice in studying, investing, working. So second in studying, of course, but also very important for investment, places you'd work in and places you'd buy from. And so hopefully that gives a little bit of background as to why we're talking about healthcare at this event that's covered mostly some of the more communication or direct national promotion elements of soft power, but actually this is a really important pillar. And what we see is that the leading institutions within this category of healthcare are often the flag bearers, the first organizations that reach out cross borders and build these relationships between nations in this category. And so we're going to have a panel with some of the representatives of the top institutions in our study. So we have Mark Byrne, who's the Chief Marketing Communications Officer from Mass General Brigham. We have Muhannad Kadi, who's the Chief Corporate Communication and Marketing Officer from King Faisal Specialist Hospital and Research Centre. And we have Professor Andrew Taylor from Great Ormond Street Hospital, who's the Director of Innovation. So yeah, please come up and we'll have a quick chat. So the first question I'm going to put to all of you, hopefully an easy one. If you could give a quick introduction to yourself and the organisation. But when you're thinking about sort of building your organisation and building these collaborative relationships, whether locally, regionally, or globally, how does the strong reputation of your organisations help you do that? What does it mean to be at one of these leading, as I said, flag-bearing sort of organisations, and how does that help you with that first step in perhaps collaboration and networking, with a particular focus on I guess, building the innovations that we see as so important for soft power and place branding? Mark, do you want to start?
Sure. Well, thank you for the opportunity to be here and speak. My name is Mark Bowen. I'm the Chief Marketing Communications Officer for Mass General Brigham, which is located in Boston, Massachusetts, in the United States. I started my career in consumer packaged goods, spent a number of years in classical marketing, left to go into financial services and then into healthcare the past 8 years or so. Mass General Brigham is a very large, not-for-profit academic medical system. We have two world-renowned academic medical centers, Massachusetts General Hospital and Brigham and Women's Hospital. We also have 3 specialty hospitals, Spalding Rehab, Mass Eye and Ear, which specializes in cancer of the head and neck in particular, and McLean, which is mental health and behavioral. All 5 of those hospitals are affiliated with the Harvard Medical School. We also have many other hospitals in parts of our business. When I think about reputation, we spend a lot of time thinking about not only our brand, but our reputation. And while they're similar concepts, we think about them a little bit differently. When we think about our reputation, we have many more stakeholders in mind in collaboration. And so we have a very large research organization. We're the largest health system-based research organization in the United States with many, many different collaborations. I'll get into this a little bit later, but Boston is known as a global hub for health sciences, medical innovation, and healthcare delivery.
So, thank you for inviting me to participate. My name is Muhannad Kadi. I'm the Chief Marketing Officer at King Faisal Hospital Research Center in Saudi. So I'm like Mark, I'm newly to the healthcare industry. I have been across in the telecom and other industry. And I have joined them for the cause of the hospital, and which is saving the people and to make sure that the welfare of the people. So I believe the healthcare industry have been transformed. And being transformed, especially after the COVID and the diseases that is emerging and is coming to this world. So we have been transforming to a non-profit organization where we are focusing more into the patient itself and how we treat him with the latest technology and the latest treatment that is invented across the globe. So again, our role as a hospital, that we are in the business of creating hope. We are not in the business of serving the people, because we need to move and beyond, especially with this emerging world.
So hello everybody, I'm Andrew Taylor, so I'm a clinical academic by background. Unlike these two, I've worked at Great Ormond Street Hospital, which is a children's hospital in London, for the last 25 years. I do research there, but I've also done medical leadership over the last decade or so, and during the first surge of COVID was what was called the silver lead, so the person responsible for the hospital and the corporate aspects of the hospital during that first surge of COVID. So worst of worlds and best of worlds in a funny sort of way. Just as a story for that, as the Chief Operating Officer, I was trying to get our hospital to adopt virtual clinics. So could we do that? We'd just gone live with a big electronic patient record, and the answer to that was, that will take you 3 years, Andrew. COVID came, 3 weeks later, we had everything changed, didn't we? It was quite amazing how just actually that galvanizing bit, and I think though healthcare changed, I would argue it's slightly gone back a little bit over the last 3 or 4 years, and that's something we really need to work on. So Great Ormond Street, so from a brand perspective, it's been around for a very long time. So we celebrate our birthday on the 14th, so on Valentine's Day. We're 173 years old, the oldest hospital in the English-speaking, pediatric hospital in the English-speaking world. And I think, as Hugo said on the slides, what drives our brand has been the ability to deliver excellent patient care. We're often seen in the UK as the last stop for patients. We've got excellent research. We interact with University College London, but researchers around the world. And I think we utilise that brand as well from an education perspective, but we utilise it really in our interactions with the European Union. So we're part of something called the European Children's Hospital Organisation, 17 hospitals trying to deal with paediatric rare disease across Europe. How do we do that internationally? We've got a large international and private patients where we're treating patients historically in country here, but increasingly, how do we advise and support people to develop their own skill sets in their own countries? But we can use that kind of brand and that expertise to build those sorts of things. And then finally, what I think we're all particularly interested in, and I think healthcare is a very conservative industry. But actually, as we move forward, particularly with lots of the new technologies that are coming forward, particularly artificial intelligence, how are we going to do this safely but at pace? And hospitals aren't quite used to doing that. And so I think that's going to be a really interesting thing for us. But how do we use our brands across the world to be able to do that? So thank you very much for inviting me today.
Yeah, no, that's good. I mean, your comments about the European Union network that you're in made me think that each of the organisations you represent isn't just a hospital sat on its own. It's within sort of ecosystems and especially sort of healthcare hubs. So especially sort of Boston is not just a hospital, but other hospitals, medical schools, but also industry. How does being one of the leading organisations and a very strong brand in that environment, Mark, help build those relationships that are needed across government, the organisation, healthcare provision, and then industry as well? There's obviously, innovation has to travel sort of across all those with regulators and commercial companies producing things to bring innovations to people. How does that help being in that hub?
Yeah. Now, Boston is considered one of those global hubs where everything seems to come together almost perfectly. So there are over 1,000 biotech companies in the Boston metropolitan area. There are obviously Harvard Medical School, MIT. If you look at the largest pharmaceutical companies, I think 18 of the top 20 have some presence in the Boston metropolitan area. And we're in the very fortunate position of sitting right in the middle of that, and we collaborate with all of them on various projects. We run over close to 4,000 clinical trials. We have thousands of principal investigators and researchers. And we also work very closely with the state on some of the problems that exist with healthcare, not only in the state of Massachusetts, such as mental health and substance abuse, but more broadly across the United States and across the world. So we also have a very large and strong innovation and ventures area. So there are hundreds of discoveries that are made in our labs, but you need a way to get the discovery to the marketplace to ultimately help patients. And so we work with a number of partners, whether they're pharmaceutical companies, venture capitalists, other partners, to develop a set of commercialization activities which translates the discovery from the lab out into the marketplace where people could benefit. So we have hundreds of people at Mass General Brigham who just work on that activity. We also have a ventures area where we invest in startups. So some of those startups happen in our own labs, some don't, but we have a lot of people and a set of activities investing in startups to try to bring them to market. So this whole ecosystem is extremely vibrant, and it leads to sharing the discoveries really across the world. We also have people from over 120 countries who come to Boston for care, and we also send our doctors and other clinicians all over the world to provide care, train people, et cetera. So it really is one of those unique situations where everything seems to come together in the collaboration really makes it drive.
Yeah,
I think there's a little bit of a change, though, isn't there? In that I think the hospitals or healthcare per se, well, not just hospitals, are beginning to drive some of that, though, because as opposed to somebody from a company coming up with an idea and then we find a problem that we need to solve. Actually, I think it's really important that those problems that we all have, particularly in how we manage health and how we manage it efficiently, we can drive that. So I think that's really important. I think the other thing for me is, particularly, so we sit clearly within the NHS as a state-funded healthcare system, but actually the data that we hold and manage, I think, is going to be super crucial for how we do some of the things going forward in precision medicine. And the fundamental of that is you cannot do that alone. The more data you've got, the more you'll be able to define better how we're either going to do precision medicine to define specific treatments or actually use some of the algorithms that are coming through from an AI perspective. So I think interesting, there's this subtle change. I think also from a university perspective, we as these health organisations hold an awful lot of this now, and how can we bring people into our ecosystems as opposed to what it might have historically been, where we kind of wait for people to come to us. So I think that's going to be a really interesting change, and that our brands will drive that.
And how does it differ being part of the NHS, where I suppose, you also have a commercial side and bringing innovations sort of forward to market because of that, I guess, different sort of healthcare system and inability to, I guess, sort of champion your own initiatives?
Yeah, I mean, I think often the people, clearly there's a good thing if it can be UK PLC and many of the things that we do. Clearly from a lot of the data things, we're up against very big competition, particularly from the US. I think a lot of what we would try, often the mantra of the things that we do is actually we would want them to be as low cost as possible for the rest of the NHS. If we are in a fortuitous position, we can develop something with a company, how would you then, but then actually from a market perspective across the globe, how then do you commercialise that much wider? So I think for us there are slightly different things that we might look at, and how you feed it back in, because clearly, as we know, National Health Service is a system that needs to be efficient, and is the monies that are within it we need to be very careful with.
Yeah. Muhannad, obviously, Andrew mentioned his organisation was just celebrated 173rd birthday. You're from a slightly younger, still decades old organisation, but I think in a more sort of emerging innovation market in Saudi Arabia. How does it differ for you? And then I guess how does that fit into some of the more openly stated government initiatives to bring innovation in different industries forward, especially for Care for SH as a leading organisation within that?
So next month we are celebrating the 50th anniversary of the hospital, and it's a big milestone for the country, because 50 years ago the ecosystem of the health was almost it's not good as is today. So there was a need almost if any tertiary care, it had to be sent abroad. With the government, that the initiative to establish such hospitals like King Faisal and others, to at least minimize the number of the people and to serve the nation. So with have been said that, we, as it stated, we moved into a non-profit organization. So we have more independency in the government regulation and so on, yet we have to follow certain type of regulation. But this has helped us in creating major milestone in innovation. One of the milestone major that happened in the first robotic surgery happened for heart transplant. The first heart transplant surgery was done 57 years ago in South Africa. So since that date till last year, nothing breakthrough have been done on the heart surgery. However, we done it through collaboration with manufacturing organization, pharmaceutical companies, and a couple of collaboration and partnership with leading institution on Europe and the state, where we have done this first robotic surgery, and it was a breakthrough in the medicine field. We think that this have not been done without the collaboration within the innovation, within the industry, the medical industry or outside it. Because I truly believe that the next innovation will not come from the medical industry. It should come with a collaboration from other industry. For example, we are collaborating now with NASA on testing some items or some research on chronic in the space to see how is the impact, what is the possible scenarios that is done, so we can take the result and do it, if it's successful, on the people itself.
That seems like a very long-term vision for healthcare as well. In our hospital study, we still see Groote Hospital in Cape Town scores very highly for innovation, which I think is just a residual positive feeling following that first heart transplant. So we see a massive sort of, not really a step forward, but a first as being a very positive result. Perhaps Mark, what's some of the innovations your organisation is, I guess, looking forward to, and are they trying to be great, step changes or breaking, barriers, innovations, or is it gradual innovation that you focus on?
Well, we manage a portfolio of innovation projects. There's a tremendous amount of clinical research that's taking place. So whether you look at cancer or Alzheimer's disease, there's tremendous progress being made all the time. I like to tell people with my mother passed away from Alzheimer's a couple of years ago. Not sure in my lifetime we'll see a cure for Alzheimer's, but perhaps in my kid's lifetime we'll see a cure. There's a tremendous amount of work and a tremendous amount of progress. So, the innovation spans, it's really focusing on diseases like cancer and Alzheimer's, but it's also in other areas, research and innovation on devices, on diagnostics, on AI tools. It really spans the gamut.
Andrew, do you have any?
I think very similar. I think, certainly from our perspective, in the rare disease world, we're looking a lot at the cell and gene therapies, particularly in the pediatric world, where others are trying to do it, is actually how do you grow. If I'm a child that's born that doesn't have a small intestine, how might I grow a small intestine so that can work? Those are the sorts of things. And then I think for us, lots of the areas where just understanding the data that we have, we've got so much of it, and how you drive that care forward so that you can interact with big pharma to do the next drug discovery around the data and the patients that we've got. This bit about precision medicine working. So I guess those are the really big areas that we're working on. I think as you've said, but we have 63 specialties, all of them trying to do something. It's a portfolio of work. Our focus though were on those sort of big three areas.
Yeah, and obviously your organisations have big hospitals, great research departments, but part of the sort of topic we're talking about is this collaboration, networks, and there's a lot of countries with hospitals represented in our ranking where they don't have a huge research university, or they know they're not going to be the one that perhaps cracks one of these big public problems, and the research is a lot more clinical. It's clinical processes and things. Is there a way that you collaborate with some of those organisations in different countries, perhaps more sort of emerging markets where healthcare is still developing, but they have clinical research? Is there ways for, I guess, sort of top big thinking innovation to collaborate with those organisations, perhaps? Mark?
Yeah, absolutely. So, we have world-renowned universities like Harvard, Massachusetts, MIT, and we work quite a bit with them. We also collaborate with health systems, not only across the United States, but across other countries as well. And it is really through that collaboration that's how the discoveries get made, and it's through the collaboration is how the discoveries get translated and commercialized and actually brought to market. But we have a four-part mission. So, patient care, research, education, and community health and investment. So I noticed you had patient care, education, and research up on some of the drivers of reputation. And those are things that we want to spread across the world. Our value proposition to patients who come here is that you're going to get the highest quality, best care that is informed by the latest research coming out of our labs, but we want to take that research and make sure everyone has access to it.
Okay. Yeah. Sorry, Muhannad.
Yeah. If building on what have been said, I think the innovation it might not come from inventing new treatment or so on. It's just invention of the process of how the people are thinking. So I'll give an example of a medicine that called Kadi. It's a medicine for cancer patients. So it was invented in 2013, and it was widely used in the state, at least. However, we started working on treating our patient in 2021. At that time, the cost was around $2 million US. However, it limits us from treating different patients. So we have to challenge ourselves and to change the mindset of how we are doing normal business. So we have partnership with the pharmaceutical companies, with the regulator, and do more clinical trial and try to localize this kind of treatment. So as of today, we have managed to do it locally in the hospital. And this cannot happen without a partnership and changing the mindset of the way that we are treating with it. We have reached 180 patients who was their survival rate 0. And now we managed to increase their survival rate to 60%, which is something considered very strong. And with the reduction of the cost, I think around 70% of the 2 million. I think this is a breakthrough. I think we need to think of inventing the process and using more technology into the process.
So we've been trying to do something similar. So if you think in the rare disease world, you might come up with a gene therapy in this particular instance. Actually, what does the current way we look at that? Oh, a pharma company needs, or a company needs to own that then will sell it back to the market. Actually, for some of these rare diseases, that makes no financial sense. So actually, one of the things we've been looking at, and also across Europe, people have been looking at, is actually, could we as a hospital, we manufacture lots of these treatments for research studies, but could we manufacture them as an organisation at costs that then could be used for rare diseases around Europe? So another hospital in Europe might manufacture something that we only have a small. So for these small numbers where we know we've got treatments that will change children's lives forever, but actually at the moment nobody can sell it to us. This makes no sense. So it's a process that. And so that's working with in the UK, working with MHRA, so equivalent to the FDA or the European Medicines Authority, working with NICE, who are the people that then work out how much something costs if you want to deliver it. So again, those processes I completely agree with, and how we can make therapies more available to everybody. We can use the reputations that we've got to do that across a country, across the EU, more widely, and use that expertise to grow that, so that there'll be certain things that will always be taken up commercially, but some of these won't be because they're just financially not worth companies. So again, just a little bit of process that might change people's lives.
Yeah. I think you mentioned taking those things to people. One of the anecdotes we heard when we were putting the study together and speaks to how the drivers of choice and recommendation are different around the world was, in Singapore, we said, is research really important? Is innovation really important? And they said, to attract doctors, yes. To collaborate with industry, yes. Patients, actually, we don't communicate it to them because they don't want to think they're, I think they said, guinea pig kind of idea. How do you see innovation as being, I guess, a key talking point for the different stakeholders, and how does being, I guess, a big name, top name brand allow you to, I guess, bring things and bring confidence in some of these innovations, new treatments, whether they're a drug, a device or technology, or processes to people? Perhaps Andrew, start.
I think in our environment, what we find is, I'm always amazed, is people will do amazing things from the parents and children's perspective. Something like 97% of when you ask people, will take part in something. And what is amazing is, it's not even if it will advance things for them, it's if it advances it for the next family, because often our families have been through a very long journey to get to where they need to get to. So I think that just is what drives them. I think the other thing is, particularly for, at the end of the day, we're a tiny paediatric hospital, but because we've got this focus on these patients, again, from a data perspective, we've got really rich data. There are things that you can develop in those environments relatively easily, interestingly, that you can then spread. So one of the things that we're really straightforward, and we'll all have it on our phones, but actually in healthcare, use of ambient technology, so something that listens, and then in this case, we've used a large language model to create an instantaneous outpatient letter. So at the end of your clinic, you leave with a letter because it's been generated. But actually, the important thing is, because we all go to somebody now and they talk to a computer, don't they? So actually, let's get rid of that. You just talk, and you talk to the patient. So patients love it. You get an accurate note at the end. Okay, it works in paediatrics, but actually, what we've done recently with something with NHS England, and again, why should a small paediatric hospital do this, was then to see if you could scale that in adults, in mental health, in general primary care, London ambulance service, A&E services. So over the year, we've now done over 5,500 patients with this new technology. But again, it's that people, it's an element of trust, isn't it? They trust what you're doing. They see that it works in possibly a complex environment. How can we make it work in less complex environments? So I think we all have a role to develop those sorts of things that we can then push out.
I can add to this. I have been working in multiple industry, among them telecom, automotive, and so on. Most of things, they tracking the Net Promoter Score, which is NPS, to shows how much is the people are confident. In our hospital, I see the number, I cannot believe it at the beginning, because we reach 70% of the people are confident of the hospital. This number is very high. But when you see and dig deep on the healthcare, you see that there are type of measurement that is not used by other industry. For example, there is something called PROM, Patient Reported Outcome Measure, which is measure the success of the hospital in achieving the ambition of the patient itself. And it's becoming widely used, where, for example, if there is someone have a knee problem, and yet not allowing him to go stair or to play football. If he entered the hospital and he find the best experience, the best treatment, the latest technology ever, but he failed to return back and to do what he is intended to go stairs and so on, it's a failure. You did not find this implemented in other disciplines. So this is very important, shows you how confidence for healthcare is very importantly role.
I was just going to say, back to the world of clinical trials, we often receive patients who go to other health systems and have been told they can't be helped. And so we all, we're kind of the place of last resort, and many times we can help them or get them into a clinical trial that may not help them, but they want to pay it forward, as you were saying. So that is really important, and a huge amount of collaboration takes place just in that process. But I want to come back to what you said about the ambient technology, because all of what we're talking about is not possible unless we relieve the administrative burden on our healthcare workers and doctors. Post-COVID, we hear a lot about burnout and clinician stress, and access is very difficult to get into. I don't know if I think it's like that in the UK. Yep. I don't know about in Saudi, but in the United States, getting access not just to a clinical trial, but even to a primary care physician is really difficult. And so it's the technology and the advances in technology that we're working on, but many others are working on as well, that will enable us to continue to do all this life-saving research and help people. Because there isn't a doctor who wants to be up till 10, 11 p.m. at night typing in notes into Epic or whatever electronic medical record system they're using. And so, that's the part behind the curtain that people don't really see, but is really critical to enable all this great work that happens.
Yeah, you nicely brought it back round to, I guess, the healthcare professional being at the heart of these organizations, whether it's someone in research working directly to innovation, or the clinicians working directly with the patients. I know in most of your organizations it's a massively international workforce. What does that, I guess, international reach, international attraction do, and how does that relate to and help in innovation for organizations?
Well, as I said earlier, we see patients from over 120 countries. So patients are coming from other countries for many times life-saving treatment. Most of it's cancer, but there's some heart as well. I think around 70% of the patients that we receive from other countries are coming for cancer treatment. And we also have a global advisory business. So we are consulting in other countries with government entities, private entities, to build world-class facilities. Because, all of these countries are developing better capabilities themselves and want to keep their own citizens in that country, and many times we help them do that. And so that is a really important part of what we do, because again, we're collaborating, we're sharing not only the discoveries, but a lot of times the operations. So we have clinicians from all over the world. You know, they were trained all over the world, or maybe they grew up all over the world, but came to Harvard Medical School for their training. They might do a residency or fellowship with us, stay with us, and then go back to their home country. So that is a big part of what we do, and so we have a very large alumni network, if you will, that helps.
So I consider myself an ambassador. Why is that? Because in the hospital, we have 80 plus nationalities represented in a campus which is 2 million square meters. I have not seen this in any other industry. So this collaboration, and this is different culture, different languages across one campus with one objective, which is the patient itself. So I think this is collaboration for healthcare. You will not find it outside. And they have to be, to put the focus. What focus is the patient? If they distract themselves about other glory of achievement, commercial, they will lose the reputation and they will lose everything related to it.
Yeah, and I think as you touched on in your introduction, and Mark has just touched on, don't underestimate those personal relationships of soft power, of people who trained in your organisation and now work somewhere else. They're very, very powerful, those networks, and I think that they can bring us together in many of the things that we do. Because I think, and we've sort of touched on it, and I agree with you, if we can get rid of the mundane, we have a limited workforce with limited skills who do a lot of mundane tasks. If we can get rid of those mundane tasks so that they can really focus on those touches that are human, that are important for us all, that will be really, really important. And I think we'll see a kind of re-envisaging of healthcare over the next decade or so, which will, and COVID triggered some of that, which we'll see much more driven by the patients. There won't be routine follow-ups. The patients will initiate follow-ups, either themselves or because of the device they're wearing. I often say, actually, we're very fortunate in that we've got probably about 600,000 beds in London because we have a child with a family member who could potentially do care, and yet we put them in a hospital bed for no real good reason sometimes. And so I think that model will really change with some of the technologies we're talking about, our abilities to deliver chemotherapies as day cases and not as long inpatient stays, targeted, all of these sorts of things will need to change for us all. And these networks that we're talking about will help drive that, because we're all talking about the same thing, aren't we?
Yeah,
How we drive that.
I think you bring up a good point, because we have tremendous access issues at Mass General Brigham, but in healthcare across the United States, very difficult to get in. And we are doing more and more in outpatient settings. We want to get people out of the brick and mortar hospitals, and have them get care near their home, near their work, in the communities. But the next step is that remote patient monitoring based on devices we're all going to be wearing or are wearing. We really need to get to that point so we can help solve some of the access issues that we all face.
By the way, we have the same issue in Saudi. Our acceptance rate does not exceed 50%. So we have to collaborate with other hospitals to make sure that they can have the same, the new patient, they have the same experience at their hometown. So I think this is a global, worldwide issue that is happening.
Yeah, post-COVID, or during COVID, people didn't come to doctors and hospitals, they delayed their care. Post-COVID, we saw this boom of people coming back who had much more serious conditions because they weren't getting their preventative care, screenings or whatever. And we've been dealing with that ever since. In the United States, we have a healthcare worker shortage. And so there's someone who is ready to leave the hospital who might need to go to a post-acute setting. There are no beds there because there are no workers, which means that patient has to stay in the hospital longer, which means they're subject to more falls, infections. So it's not good for anyone. So this is a problem that we have to solve in a number of ways, but technology is certainly going to be a big part of that.
Okay, cool. I think I have a couple of minutes. One last one. You might not be able to answer this, but obviously our audience is a lot of people who work in place branding, place promotion, and I suppose work closely with councils, government, regulatory sort of adjacent organisations. Is there something that you think your organisation could teach or benefit more from in engaging with those organisations to be able to build networks? What could the city do to connect you, whether it's with industry or with other organisations perhaps, or do you have an anecdote about how some of those interactions have helped? Perhaps, Andrew, if you have an answer.
So from a wider community piece, I think it's really crucial for all the reasons that Mark's just said, is that, and I made the slip up, didn't I, where I said hospital. Actually, it's not about hospital, it's not about healthcare, it's about health. I think for once the UK government's kind of got its three priorities right, because actually those are the sorts of things, whether it's from analog to digital, whether it's from hospital to community, and whether it's from disease to prevention. These are the journeys that we need to go on if we're going to avoid some of the things, the problems that we've got into. So those are going to be really, really important. So there's lots to learn there, 100%.
So I think with the country or with the nation, they are more focusing about the quality of life of their citizen to ensure or to attract more of the investment, more of tourists and so on. So we need to work closely with them because having a reputable hospital within the country itself will ensure to the people that the health system is good and it's dependable. So I think a reputable hospital will get back to the community when in the income and as long as ensuring that the ecosystem of the healthcare is very strong.
Yeah, we do a lot of collaborations, starting with the city. We just were talking about the critical shortage of healthcare workers. So we've got a number of projects working very closely with the city of Boston to develop a pipeline of future healthcare workers. We work with the state of Massachusetts, working on really critical healthcare issues, whether it's mental health, substance abuse, opioid addiction, and work very closely with the governor and her administration on that. And then we work with the federal government in a number of ways as well. So that is a big part of all of the reputation work that we do all the time.
The only one thing I would say, and I think in places like Boston in particular, I think it's sometimes not clear how the startup world works in the UK, and that would be something that I think we could definitely bring together and learn from others about how we make that work. And I think some countries have got that working really well. Estonia, you mentioned Estonia, I do some stuff with Latvia as well. Actually, it's very lined up, clearly small population. But I think there are things that we, from a UK perspective, particularly in that startup world, could learn from others. It's not as smooth as it should be from my perspective.
Okay, thank you. I think that's time up. But thank you so much. I think we've learned a lot about innovation. I think I was probably thinking more and leaning towards big innovation, but I think saving innovations, ease innovations are, I think, just as important, if not perhaps more important. At the moment, so can everyone please thank our three panelists for a great discussion. Thank you.